Suicide is one of the hardest realities we face in mental health. Even with years of training as a psychiatrist, I have still lost patients to suicide, and I carry those people with me in my thoughts very often. It's a humbling reminder that even if we do everything we can, there are still forces outside of our control and pieces of human suffering we may never fully understand. That's why this conversation is not about blame or about what we should have done differently. It's about learning together so we can lessen risk, notice changes earlier, and create more opportunities for intervention and for hope. I'm Dr. David Danish, a double board certified psychiatrist, and I specialize in treating depression and suicidality across the lifespan. And in this video, I'll walk through the most important research-backed warning signs of suicide in adults, teens, and even preteens. The goal is to help everyone feel more confident in recognizing shifts that might signal someone is in crisis and to know when stepping in could make a real difference. And at the end, I'll share an important free resource we built that gathers these warning signs into clear, practical checklists, something you can use yourself or share with teachers, friends, or family, so none of us has to carry this responsibility alone. In adults, research shows 3 red flags rise to the top again and again when it comes to suicidal risk. Hopelessness, unbearable pain, whether that's emotional pain or physical pain or both, and severe anxiety. Hopelessness often comes out in small but powerful phrases. Things will never get better, or I don't see the point anymore. These are not casual comments. They're signals of a deeper despair in most people who say them. Unbearable pain can be both emotional and physical. Chronic illness, relentless stress, or emotional torment can all push someone closer to a breaking point. And then there's anxiety and agitation that comes from anxiety, whether it's restlessness or pacing, sleepless nights, ruminating. Studies show these often cluster with other symptoms like social withdrawal, crying spells, or even physical complaints like headaches, stomach aches, pain, severe fatigue. Sometimes the body shows us what words do not. One of the most humbling lessons from recent research is this: not everyone follows the same pathway when it comes to suicidal actions. About half of suicide deaths happen without prior attempts or even documented suicidal thoughts. For some, physical illness, pain, or sudden disability play a bigger role than depression itself. Even among psychiatric patients, there are subgroups. Some people externalize through impulsivity, substance use, anger, aggression. Others internalize through withdrawal from others, hopelessness, or despair. Both sets of patients deserve attention because both can end in tragedy if overlooked. Now, with children and teens, the picture looks a little different. Suicide is the second leading cause of death for ages 10 to 24. Unlike adults, preteens rarely use substances before an attempt. Their risk is often driven by impulsivity. A fight with a parent, a breakup, or bullying can lead to an attempt within minutes, not weeks. Bullying, especially cyberbullying, is one of the strongest school-based predictors of suicide risk. And chronic sleep loss or school absenteeism also show up again and again as major red flags. And here's the nuance with social media. Yes, harmful content can worsen despair, but online spaces can also provide life-saving connection, especially for LGBTQ youth who might feel isolated online. The key is not monitoring screen time, it's talking about what content they're consuming and sharing and believing. That conversation might reveal risk before behavior shifts become visible in real life to family members. The CDC gives us some practical advice and a checklist anyone can use. These include talking about wanting to die or being a burden to others, expressing hopelessness or unbearable pain, sleeping a lot more or too little, withdraw from friends or family or activities, extreme mood swings or rage, seeking access to lethal means online, sudden agitation and reckless behavior that seems out of character to who they were months or years before. And here's the most important point. It's not one sign in isolation that matters most, but a sudden cluster or change from someone's baseline. Asking directly, are you thinking about suicide? Does not plant the idea. Please do it if you have the concern. Research shows it communicates care and it can open a door to hope, and I'm making a whole other video all about that. Recognizing suicide warning signs is not about hindsight or blame. It's about being prepared to notice patterns in the future. No one can catch every sign, but knowing what to look for gives us a slightly better chance to intervene when it matters most. If you want a clear, accessible, written reference, I've built a free Mind Vault resource that lists the most important warning signs across preteens, teenagers, and adults, because they all differ, drawn directly from the latest research. It also includes practical checklists you can share with teachers, friends, or family, so the responsibility of noticing does not fall on just one person. Alongside this, the Mind Vault I'm referring to at drdaviddanish.com holds resources on nearly every psychiatric medication, psychiatric condition, including valuable screening tools for depression. I'll be sure to put those links in the description. Please remember to like and share this video with others. Please subscribe to the channel because it will help get the word out there, and hopefully this could help someone get caught before they try to take their life. I'll see you in the next video.